Good afternoon, everyone. I'm Congressman Hakeem Jeffries, Chair of the House Democratic Caucus. Welcome to the House Democratic Caucus Roundtable on Black and Brown Maternal Health and Environmental Justice. I'm so thankful for the extraordinary panelists who will be introduced shortly for their involvement, leadership, and participation in this panel, as well as for the participation of three extraordinary members of the United States House of Representatives who have been leaders on the issue of Black and Brown maternal health and a wide variety of other issues on behalf of the House Democratic Caucus. But with respect to this particular subject, I'm so thankful for Congresswoman Robin Kelly, Congresswoman Lucille Roybal Allard, and Congresswoman Lauren Underwood for all that they have done and are continuing to do to make sure that in the United States of America, there are no disparities that exist between the maternal health of every single woman, regardless of race, regardless of zip code, regardless of immigration status, regardless of station in life. This is the wealthiest country in the history of the world. And yet we know that maternal health is often a function of race and geography as it relates to the disparate outcomes that have befallen Black and Latina women, as well as their children, often because of the exposure to environmental conditions that are toxic in nature, as well as a result of the inadequate healthcare infrastructure that tends to exist in many Black and Brown communities throughout the United States of America. The COVID-19 pandemic has been both a public health crisis and an economic crisis, and we know that it has hit communities of color in a disproportionately adverse fashion. But these are disparities that had existed long before the onset of the pandemic. The pandemic, however, has opened up a lot of eyes as it relates to the need to deal with systemic racism and inequality in America. And it is our hope that we can make tremendous progress on the issue of Black and Brown maternal health as we emerge from this pandemic and begin to deal with the underlying conditions that have been afflicting communities across the country for far too long. So thank you for joining us. And before we proceed to our panel discussion, let me introduce Congresswoman Alma Adams from the great state of North Carolina, one of the leaders of Black maternal health in the caucus, who will be sharing a few words with us via video.
Good afternoon. I'm Alma Adams, representative of North Carolina's 12th District and co-founder of the Black Maternal Health Caucus. Thank you to our Democratic Caucus Chairman for hosting today's roundtable on Black and Brown maternal health and environmental justice. This conversation is timely as our nation continues to grapple with the pervasive systemic racism in America, including in our environmental, energy, and healthcare systems. The impact of those systems, the price we pay for pollution and global warming, and a lack of diversity in our medical fields, it isn't paid evenly. Low-income, Black, Brown, and Indigenous communities are disproportionately hurt by negative environmental impacts. And environmental injustice and systemic racism also directly affect one of the biggest public health crises of our time, Black maternal health. In the US, the rate of maternal mortality is now worse than it was 25 years ago. For Black women, the risk of death from pregnancy-related causes is a staggering 3 to 4 times higher than for white women. And Native and some Latina communities also face higher risks of poor health outcomes when compared to white women. These health disparities that Black and brown mothers and infants face are further exacerbated by environmental racism. For example, communities of color are disproportionately exposed to air pollution, which studies show can increase the risk of premature birth and low birth weight. The maternal health crisis and all its causes must be addressed. And that's why last April, Congresswoman Underwood and I launched the Black Maternal Health Caucus. And it's why earlier this year, our caucus unveiled a comprehensive package to address these issues. The Black Maternal Health Omnibus Act of 2020 is a package of 9 bills that build upon existing legislation to comprehensively address the maternal health crisis. Our legislation would train providers to screen for social determinants of health, including environmental risks. And to help address those risks, it commissions a study on the impacts of climate change and pollution on maternal and infant health outcomes. The Momnibus provides a roadmap to ensure our healthcare system, lawmakers, and society prioritize Black and brown maternal health. And we cannot address the maternal health crisis without addressing the environmental disparities that contribute to it. No one should have to live beside a brownfield site in any area with high air pollution or in a home with water that isn't safe to drink. And no one should have to lose another friend, auntie, sister, daughter, or mom. Thank you again for allowing me to join this important conversation.
Well, thank you very much, Representative Adams. It's great to see you, albeit virtually, and certainly look forward to the moment when all of us can be together in person. It's now my honor to yield to Representative Lauren Underwood, one of the few distinguished nurses who is in our midst as a member of the United States House of Representatives, and so thankful for her spirit, her intelligence, her experience, and the work that she brings to bear, particularly as one of the co-chairs and co-founders of the Black Maternal Health Caucus. I yield now to the distinguished gentlelady from the great state of Illinois, Congresswoman Underwood.
Well, thank you, Mr. Chairman. Hi, everybody. I'd like to thank Chairman Jeffries and the House Democratic Caucus for hosting this virtual roundtable on the intersection of maternal health outcomes and climate change, particularly for women of color. I'm honored to co-host today's event with 2 great maternal health champions, my colleagues, Congresswoman Robin Kelly and Congresswoman Lucille Roybal-Allard. And I extend my gratitude to our field of experts for joining us to share their research and personal experience with this issue. The science on climate change is clear. Average global temperatures are rising, a trend that is coupled with elevated levels of air pollution and other environmental risk factors. We know these dangers are not abstract. They are a threat to our economy, our national security, and to most fundamentally, it's a threat to our health. And like so many risk factors for adverse health outcomes, the impacts of climate change are not distributed evenly across our population. African Americans, Hispanic Americans, Native Americans, and other communities of color in the United States face heightened vulnerabilities for adverse health outcomes associated with climate change. In June, a new study published in JAMA added more evidence to illuminate these disparities. The study found that exacerbation of air pollution and heat exposure related to climate change may be significantly associated with risk to pregnancy outcomes, and the risks are disproportionately high for Black mothers. Racial disparities of maternal health outcomes have been a top priority for me as co-founder and co-chair of the Black Maternal Health Caucus. Just as the data on climate change clearly convey that we are facing a crisis, the statistics on maternal health outcomes demand attention and action as well. Black moms in the United States die from pregnancy-related causes at 3 to 4 times higher than the rate for white moms, an inequity that exists across income levels, education, and any other demographic factor. That's why I introduced the Black Maternal Health Omnibus Act in March, a set of 9 bills to comprehensively address every aspect of this crisis. One title of the Momnibus, The Social Determinants for Moms Act, commissions a study through the National Academies of Sciences, Engineering, and Medicine to assess the impacts of water and air quality, pollution levels, and exposure to extreme temperatures on maternal and infant health outcomes, with a particular focus on women of color and their families. This study and other provisions in the Momnibus to address exposure to environmental risks in pregnancy are important steps, but we know that there's so much more work that needs to be done. Today's event will inform and motivate those urgent efforts. Our speakers bring both impressive research backgrounds and moving personal stories to the conversation. Our first speaker, Dr. Bruce Picard, is the lead author of the JAMA article that shined a light on the disparate impacts of climate change on maternal health outcomes. Dr. Picard is also a women's health physician, author, and educator who's been engaged with the climate crisis since 2007. As a full-time activist since 2013, he serves on EcoAmerica's Climate for Health Ambassadors Advisory Committee. He's the chair of the Public Health Advisory Council of the Climate Action Campaign, and he works with nonprofits like the Climate Reality Project, the American Lung Association, and Environment America. I am now pleased to introduce Dr. Bruce Picard for his opening remarks.
Good morning. Thank you, Representative Underwood, Chairman Jeffries, and esteemed House Democratic Caucus members. We're really happy to be speaking with you today about this. As has been stated, I've been involved with efforts to stop climate change since 2007, primarily speaking and writing about the health effects. In 2015, the American Academy of Pediatrics issued a detailed paper about climate's effects on children. As an obstetrician, naturally I wondered if pregnancy was being affected, but there was no such big picture analysis at the time. In early 2017, I was fortunate enough to connect with Dr. D Nicola and two other outstanding academic doctors, and we set out to answer that question, whether climate was harming pregnancy. What we discovered astounded us. In all, we evaluated over 1,800 recent articles and found, hiding in plain sight, lots of studies on preterm birth, low birth weight, and stillbirth, and their association with heat and two kinds of air pollutants that are closely related to climate change, ozone and fine particulates. We limited our search to U.S. domestic populations so nobody could come back later and make that old excuse that, well, climate change only happens somewhere else. We identified 68 studies that met our criteria, and 57 of those 68 found a really strong association between either heat or those air pollutants and these bad birth outcomes. And by the way, these are big studies. They average over 500,000 births apiece, and the total is over 32 million births all across the U.S. So when the Journal of the American Medical Association published our work on June 18th, it became the first ever large-scale review of these very common, pervasive climate-related impacts and bad birth outcomes across this country. Regarding these pregnancy outcomes, certainly stillbirth is an absolutely devastating event for any woman and her family. However, preemies and low birth weight babies, although often able to survive these days, frequently have significant respiratory and neurologic problems as children and face major health risks as adults. It's a really dangerous way to begin a life. One of our key findings, we found strong evidence of racial disparity among the studies. More than half of the studies noted worse outcomes for minority mothers, with Black moms called out more than twice as often as Latinas, the next highest risk group. In a moment, Dr. D Nicola will go deeper into these results and explain why we think these associations are not just random, but likely cause and effect. In my remaining time, I want to say a few words about how we respond to this new information. In a way of context, I'd like to make a medical analogy. Climate change is like a cancer. It's not something that can be adapted to. It must be confronted and eliminated, and we don't have unlimited time. All general policies that address climate change will help to stop these problems from accelerating. Things like reversing the recent rollbacks in air quality standards, rejoining the Paris Climate Accords, ending oil subsidies, finally. But more specifically, we must end the environmental racism of redlining, which sentences citizens of color to endure more heat and ozone than surrounding neighborhoods. Specific approaches that address the risk to pregnant women, especially minority mothers. We're already doing public health outreach around heat waves. These efforts should be directed towards pregnant women, especially minority mothers, and particularly in urban areas where air pollution is also a problem. We should develop and finance programs through clinics and provider offices to support environmentally at-risk pregnancies through culturally appropriate education and social services efforts. We should strengthen the network of air pollution monitors, especially in high-risk areas. And we need to fund more research. Many questions of our study are still unanswered, and there's much more to be learned. It's important, though, to keep in mind that although it's going to take time for these measures to have their full effect on the climate, they will act immediately to safeguard public health, reducing premature deaths and, we now believe, premature births. So in conclusion, the time has come to shift public perception of climate change from polar bears to pregnant moms, and virtually everybody cares about protecting pregnancy. Our call to action is we can't allow our addiction to fossil fuels to result in generations born weakened from birth. And finally, for those mothers and babies suffering first and worst, Black Moms Matter must be more than a memorable meme. It must be codified in meaningful action sooner rather than later. Thank you.
Dr. Picard, thank you so much for that very thorough, thoughtful, and important presentation. Let me now yield to one of the distinguished members of the Appropriations Committee, an incredibly well-respected member of the House Democratic Caucus, and one of the co-founders and co-chairs of the Bipartisan Caucus on Maternal Care, distinguished gentlelady from the great state of California, Representative Lucille Roybal Allard.
Okay. Thank you, Chairman Jeffries, for convening today's panel on Black and Brown maternal health and environmental justice. I represent the most Hispanic district in the U.S. More than 86% of my constituents identify as Latino. When you add my Black and Asian constituents, my district is more than 94% minority. Today's topic is certainly critical to my constituents. But I'd like to begin by dispelling a myth that the fight for environmental justice is relatively new to poor and minority communities, because the fact is that for generations, these communities have fought against the projects that endanger the health and safety of their families. But their cries of fear and protest continued to fall on deaf ears until the negative impacts were felt by more affluent communities. Only then did the environmental movement begin at large. Los Angeles is a perfect example. During the 50s, ignoring the protests, freeways were built through Latino communities, which continue to poison the air with lead. In my district, the PEMCO Superfund site is the result of a chemical mixing facility polluting the soil and groundwater with dangerous contaminants from the late 1940s to 1991. In 2013, we learned that for decades, an Exide battery recycling plant emitted toxic metal dust, contaminating at least 10,000 homes. That contamination has caused serious health and disability issues for families, especially their children. And this past January, at an altitude of just 2,000 feet, a Delta plane making an emergency return to LAX dumped over 15,000 gallons of aviation fuel over one of my cities, sickening dozens of children playing in the schoolyard. As co-founding chair of the Congressional Maternity Care Caucus, I am grateful to our panel for your commitment to explore the science around environmental justice and its impact on minority, maternal, and infant health. Your advocacy to raise awareness of the special needs and experiences of this often ignored population is commendable. I now have the privilege to introduce Dr. Nathaniel D Nicola, a board-certified OBGYN at Johns Hopkins Health Systems in Washington, D.C. Dr. D Nicola did undergraduate studies at the University of Pennsylvania. He went to the University of California, Irvine for medical school and completed his residency at Tulane University in New Orleans. He is the ACOG environmental health expert and liaison to the American Academy of Pediatrics Executive Council on Environmental Health. He has published peer-reviewed articles on environmental exposures, on reproductive health, and is an international speaker on this topic. In June 2020, he was senior author on a published JAMA review entitled Association of Air Pollution and Heat with Preterm Birth, Low Birth Weight, and Stillbirth in the US. Dr. D Nicola, thank you for being here today.
Thank you to Chairman Jeffries and this entire esteemed and incredibly important caucus. We can begin by pointing out that everyone here has already some experience with how environmental toxins influence maternal health. One of the first things people know about pregnancy is that you have to watch what you eat and drink. And when it comes to food, you have to watch fish. You may not know all the details, but you know that fish could be a problem. The reason that we're familiar with this is that for decades in Minamata Bay, Japan, there was industrial waste spillage that eventually bioaccumulated into the food supply, was consumed by the children in Minamata, and they developed all kinds of seizure disorders and ataxia and death due to mercury poisoning. So that was how we came to know about water pollution influencing pregnancy. And now we're dealing with air pollution. And likewise, we have decades now of accumulated data that Dr. Picard summarized. And what we're seeing is that not only is there this association, but whenever you look at an association, you have to ask, is there biological plausibility? Is there reason to think that these might be linked by something that isn't random? When we look at air pollution and the two most studied contaminants there, PM2.5, which is particulate matter, fine particulate matter, 2.5 microns, and ozone, those are biologically active at the placenta. They contribute to things like oxidative stress and inflammation, two very common pathways to pathology and adverse health outcomes. We also now know that those are involved in altered gene expression at the level of the placenta, which can certainly be tied to things like preterm labor. Another common symptom of pregnancy that most people are familiar with is this idea of Braxton Hicks contractions or false labor contractions. The most common cause of that is dehydration. And when it comes to extreme heat, the same pathway that releases prostaglandins and oxytocin, which are implicated in preterm delivery and can involve low birth weight babies, could be revved up to a point there is some plausibility here. The other piece we look at for plausibility being more than just an association is if there's a dose effect. And in our research, what we found was that there was essentially concentric rings that you could draw around some of these exposures and the outcomes. So for 1.1 million live births in Pennsylvania, if you were within 1 kilometer of a fracking site, the risk for low birth weight baby increased by 25%. When you went beyond 1 kilometer and out to 3 kilometers, the risk was high, but not quite that high. And then beyond 3 kilometers, the risk was back to baseline. And this highlights what we had referred to in our paper, which is when we talk about these localized effects, they do disproportionately affect minority communities and communities of color. The concept of heat islands is not new. In fact, just this morning, the New York Times ran an article on it. And essentially what happens is that due to decades of city planning that had racial bias, the communities of color and minorities communities live in some of the unhealthiest parts of the city. And this disproportionately creates risks associated with things like air pollution and heat. One of the studies that were among our 68 that we reviewed in California found this increased risk for preterm birth across the board, across all mothers. When they looked at the disparity, the increased risk for Black moms compared to white moms, and they tried to tease out what exactly was the contributing factor, they looked at just the extra air pollution they might have been exposed to. Then they looked at the neighborhood factor, which would essentially be the heat island or the environment that they would spend most of the time living. And the neighborhood factor ended up being double in the contributing effect to the increased risk for preterm birth. So this is a very real effect that goes beyond simple analysis of things like demographics. and it really needs to be looked at from a systems approach. One of the hardest things that I've seen recently in clinic are patients coming to me having seen some of these studies, and they want to actually plan where they live because they're going to be near a highway with one home purchase, but they don't have the option to move. We have to remove some of the individual burden on things that really are a systems effect. Now, the medical societies are releasing guidance. ACOG, the American College of Obstetricians and Gynecologists, has a committee opinion on toxic exposures that draws some attention to this. The Medical Society Consortium on Climate and Health is an aggregate of many different medical societies that overall represents about half of US physicians. They are calling attention to the effects of climate change on human health. But really, we are looking to higher level impacts because there's only so much that a mom can do to protect herself from the heat she experiences and the air she breathes. I'll just end with one example that I think is good news. And it's from the experience in California, where they retired coal power plants. And over that 10-year period, the preterm birth rate dropped 25%. Now, if you ask high-risk pregnancy specialists, there's hardly anything that we can do in obstetrics to reduce the preterm birth rate by 25%. So these health benefits are accrued rather quickly, and we need to be looking to these across maternal outcomes, but especially in the systems that have made it disproportionately affecting Black women and women of color. So thank you so much for hosting this very important caucus.
Thank you very much, Dr. D Nicola, for that compelling presentation and for your expertise on this incredibly important matter. Let me now yield to my good friend, my classmate, the chair of the Congressional Black Caucus Healthcare Brain Trust, as well as someone who has also been a tremendous leader on the issue of Black maternal health within the caucus and throughout the country. The distinguished gentle lady from the great state of Illinois, by way of Harlem, USA, Congresswoman Robin Kelly.
Thank you so much, Chairman Jeffries, for that kind introduction. I'm honored to be here with you and my other colleagues, my other champions. Good afternoon or good morning, depending on where you're at. I would also like to thank our panelists for agreeing to be with us today. It is important for lawmakers, healthcare providers, and advocates to collaborate on finding solutions to the growing crisis of American mothers and babies, especially those of color, needlessly dying during pregnancy, childbirth, and the postpartum period. In Congress, I serve on the Energy and Commerce Committee, including the Health Subcommittee, and as was said, chair the Congressional Black Caucus Health Brain Trust. So health care and healthcare access are important issues to me. I have been using my platform and the backing of the CBC to advocate for maternal health since my early days in Congress. We have discussed the contributors to maternal mortality and ways to improve maternal health. That is why I'm so glad to be joining my wonderful colleagues in today's conversation. Climate change is the fight of our generation, and it is encouraging to me that our panelists today are using research and advocacy to fight the effects of climate change on maternal and infant outcomes in communities of color. I couldn't agree with my colleague from California more. I've seen in my district, my low-income district, where many of my Latinx and Black constituents live, that they have been fighting companies that came to the area with pet coke. And these companies, we noticed, they went from one low-income area to another across the United States. So I'm happy to be here to continue to champion the environmental health disparities that people like Catherine Flowers are fighting on the front lines every day. That is why I'm honored to give the introduction of Ms. Flowers today. Catherine Flowers currently serves as a Texas field organizer for the Moms Clean Air Force. As a former New Orleanian who was displaced by Hurricane Katrina, she and her family were directly impacted by the effects of climate change in our safety, security, health, and well-being. This experience led Catherine to make it her mission to fight for the health and environment of her adopted hometown and focus her career on advocating on behalf of those whose voices are most often silenced. I will now proudly turn it over to Ms. Flowers.
Thank you so much. Thank you for inviting me to participate in this roundtable. It is an honor to be here. I want to say a special thank you to Honorable Jeffries and Honorable Kelly and Honorable Adams and Honorable Underwood and Honorable Rebel Allard and the team at Moms Clean Air Force. I am the Texas field organizer for Moms Clean Air Force, and I live in Houston. We are incredibly thankful to Rep. Adams and Rep. Underwood for their leadership in creating the important Momnibus legislation that would improve maternal health outcomes for mothers like me. I would like to share a very personal story about my experience as a very young mother of color. I experienced the disparities of our maternal health system when my water broke with my daughter prematurely. The hospital staff did not look like me, and no one believed me when I told them that my water had broken. The nurses on staff wanted to admit me to the psych ward instead of the labor and delivery floor. I remember it like yesterday. I had just come from City Hall regarding a meeting for the youth bill program, and they thought I had a mental health issue and would not believe me when I told them that I was in premature labor with my baby. I was 7 months pregnant. My daughter is now a young adult and graduated recently from Tulane University and is currently in grad school in Sarasota, Florida. But the experience was traumatic, and it has left a lasting impact on my life. I am also a Hurricane Katrina evacuee. I left my life in Louisiana after my community and home were devastated from the hurricane and transplanted with thousands of other evacuees to Houston, Texas. Recently, I've personally survived Hurricane Harvey, and I helped to serve thousands of people to overcome the damages from that catastrophe through a disaster relief organization that I had the honor of leading. My work also includes ensuring that everyone has access to clean air and a healthy environment. Your zip code should not dictate your quality of life. Unfortunately, Houston and many cities in Texas has one of the highest rates of pollution in the country. And air pollution disproportionately impacts communities of color. Today, I use my voice and my experience to advocate for families who traditionally feel they do not have a voice. In order to fix a problem, we must agree on the problem. Connecting the dots to air pollution and the impact it has on mothers and their babies, or the high rate of COVID in communities of color, is essential to the efforts to urge decision makers to employ fair distribution of equity to address the lack of resources in communities that need it most. Recently, I was quoted in the New York Times article titled "Climate Change Tied to Pregnancy Risks Affecting Black Moms Most," that showed women who are exposed to high temperatures or air pollution are more likely to have premature, underweight, or stillborn babies. This is a moment of reckoning for racial injustice and health disparities. Doing nothing about air pollution, which so clearly has a greater impact on Black Americans, is racism in action. My goal through my work with Moms Clean Air Force is to help build capacity for communities and our elected leaders and advocates. We can all benefit from adding additional tools in our community building toolkits, so we can collectively come together to address basic needs like clean air. Moms Clean Air Force is a community of more than 1 million moms, dads, aunts, grandparents, and students united to address air pollution, climate, and our kids' health. No matter what city you live in, we invite you to join us. Together, we can be an unstoppable force. Thank you so much for allowing me to share my story and to invite you guys to be a part of the solution.
Well, thank you so much, Mrs. Flowers, for your advocacy and for sharing your story and for joining us today. Last but certainly not least, it's now my honor to yield to our final presenter, Alexia Harad. who is from, did I get that right?
Yes.
Okay, close enough. But I appreciate you being with us. She is from Western New York, where she is a senior services director, perhaps most importantly, one of the founders and leaders of Melanated Moms.
Yes.
Now, those of you who know me know that I like alliteration. That is right at the top of the list. And we certainly appreciate your advocacy and leadership of that group, which advocates on behalf of moms and women of color. You are also the mom and the wife, but the mom of a 6-year-old, a 3-year-old, and I believe a 1.5 week.
Yes, he's 11 days. So if you hear
days.
him, I'll grab him. I'll show you all how.
Well, that's amazing. And thank you so much for joining us so shortly after your birth to share your experiences, the challenges that you've overcome in your fight on behalf of other moms and women.
Okay. Thank you so much, Chairman Jeffries. Again, my name is Alexia Harad. I am the co-founder of Melanated Moms, and we also signed on to be part of the Mombiz bill package, so we're super excited about that. I did want to share my birth stories with you guys. Like I said, I have 3 children, 6, 2, and 11 days, and each of my birth stories were completely different from the other. My first pregnancy with my son, who I affectionately call the kid. I wanted to have a natural birth, and we went through all the classes and all of that, and I ended up having an emergency C-section because his heart rate was dropping, and it was due to fetal distress. So I remember distinctly the midwife coming to talk to me, asking me, was I comfortable with the C-section? And although I wasn't, I asked her, was it okay that I declined? And she literally looked at me like I had 3 eyeballs and said, well, you can decline if you want to. And I just wanted the option to say no. But because of the distress he was going through, I ended up having a C-section with my son. Now, my daughter probably has the most entertaining story. I remember going into labor with her. I was in labor with her for 4 days. I remember going to get my final checkup and explaining to the doctor that, I'm feeling much more uncomfortable than I was previously. The last time I got checked, it just progressively got worse. And she just kept telling me, oh, that's normal. Your body's just getting ready for labor. But in all actuality, I was in labor, going to work, taking the kids to and from school, just doing my normal mom thing. And I believe it was, she was born on a Saturday. So Friday night, I ended up going to the ER, and they kept me in this room, trying to see if I was dilated, and I didn't dilate at all. I was only 2 centimeters dilated. And I just kept having more and more intense contractions. My husband was asking and pretty much begging them to keep me in the hospital, and they pretty much denied that request, and said, no, you have to go home. Here's some Benadryl, take a hot shower, and, call us when your water breaks. So we ended up driving back home, which was a 20-minute ride. And my water ended up breaking at home, in our bedroom, and we called the ambulance. I'm asking these people what's going on, because I didn't go through this with my first pregnancy with my son. So I'm panicking. I'm not really sure what's going on. I was very frustrated because I was trying to tell the staff at the hospital that something was different. I was in labor. They said, no, I wasn't, because I wasn't dilated enough. So they take me in the ambulance. I'm going to the hospital, and I'm actually starting to have the change, and I feel the urge to push. And so I do, and I'm asking the EMT, what am I supposed to do? Why am I feeling this way? And the poor girl, I felt so bad for her. She had no idea. I think it was like her 3rd day on the job. She never saw a baby being born. So she was completely clueless and probably more scared because I was asking her these questions, and I was probably very loud, but I was in labor. But she ended up, my daughter, who I call the tiny human, ended up being born outside in the hospital parking lot on the ambulance gurney. I delivered her by myself, no epidural, which I thought that's my superpower now. And she was healthy. She was crying. She was only 5 pounds, 6 ounces, but she was just as feisty as someone that I know. But when I got to the labor and delivery, the doctor goes, "Oh, well, that's not how it was supposed to happen." And clearly it's not. And I told her that she should have kept me. She should have listened to how I was feeling. And again, like Ms. Flowers said before me, nobody in that room looked like me. So I felt very uncomfortable knowing that I was trying to tell them exactly how I was feeling and nobody would listen. If we fast forward to this recent pregnancy, my son, who I call baby because he's the baby, I had 6 hours of labor, and this time around, I knew exactly what I needed to do. I made sure that I was advocating for myself, and my husband also was doing the same thing. I went into labor in our new house because we just moved to a new house, and I got to the hospital. They were asking me these questions, and they were saying, "Well, we were going to put you in the waiting room to see if you're going to dilate or not." And I said, "Absolutely not. I am in labor." I said, "These contractions are 2 and 3 minutes apart. They're very intense. I am not going into that waiting room." I said, I need a labor delivery room." So that's where they put me. And my husband was my cheerleader in the back. And a few hours later, after getting to the hospital, my son was born, and he was healthy, and he was 6 pounds, 7 ounces. And so I'm here today to share those stories with you. I do know that there was some issues with, I don't know if you guys have ever heard of the Love Canal in Niagara Falls. There was a company called the Hooker Chemical Company that dumped, I think it was, they would put chemical waste in 55-gallon drums, and it was covered over 16 acres of land, and it was covered, it ended up being a landfill, but they ended up selling the property to a school board in Niagara Falls, and they built a school and housing. And what ended up happening in Niagara Falls for women, it was a low-income area, was that they ended up having miscarriages because of the chemicals that were leaking into the water and the land that they were living in. The school board knew about the issues, but the homeowners did not. A lot of people ended up getting cancer. Women started having miscarriages. I have a few friends that lived there, and their parents grew up there, that are now diagnosed with, different kinds of cancer, especially leukemia. So, that environmental piece here is very prevalent in the Western New York area as well. So, I'm proud to be a part of this panel and hoping to come up with some solutions as well. So I think that's about it.
Thank you, Alexia, for taking the time to join us today to share your story, especially with a newborn, my goodness. And also, I'm very familiar with the Love Canal. I think you referred to, I remember the movie about it. I also want to thank our guests for sharing their valuable wisdom with us during their presentations. We will now begin our member questions, and I will ask my colleague from California, the great Lucia Roybal Allard, to start. Lucia.
Thank you. Doctors Becker and D Nicola, I understand that your research was a meta-analysis of 57 studies that looked at the impacts of air pollution and heat exposure on pregnancy outcomes. It's sad but not surprising that the research found preterm births, low birth weights, and stillbirths were worse in Black and Brown communities, because these same pregnancy outcomes have always been more prevalent in minority communities. Could you please explain how outcomes in these studies are controlled for the cumulative impact of other negative factors that affect minority communities. In other words, in determining the causes of preterm birth, low birth weight, and stillbirth, how is the impact of climate change factored out from that of poor nutrition, other environmental exposures, limited access to care, higher rates of diabetes, asthma, and poverty?
Thank you for the question. And I'm going to let Dr. D Nicola address the specifics of the scientific method, because this is really an area that he has great expertise in. And I'm a clinician. I delivered babies for 20 years before I got involved with this research. But I do want to clarify, this was not a meta-analysis per se. It was more of a systematic review where we combined results from multiple different studies with various approaches. So there's no way to really quantify, to add together and actually come up with a meta-analysis that gives us an estimate of risk. But in fact, that's part of the strength of this study too, was that so many different techniques and measurement methods were used, and there was such a high degree of correlation with the outcomes, such a high degree of agreement. So anyway, let Dr. D Nicola talk a bit more about how the other factors are controlled for. It's a good question.
Thank you for that question. What we're really talking about here are these social determinants of health, which are rather established and recognized to really disproportionately affect minority communities. And then overlay on top of that, the environmental determinants of health. The way you try to sort those out is with the methods that we can use to account for any kind of variables. It's called logistic regression. We put them into a model where we do account for all the other things. And if you dig into our study in the supplemental tables, which are really dense in data, you'll see they're almost all adjusted odds ratios, so the AOR. And what the adjusted odds ratios are adjusting for many of the things you just mentioned. So adjusting for other health conditions, adjusting for, where possible, the geography. Now, you can't always account for every factor, but that's where you look to large volumes of study participants. So we had, on average, 500,000 women in each study. When you have that volume and the signal still shines through, it really lends a lot of credibility to that signal being real. And then, like I mentioned with Dr. Basu, in their study where they tried to tease out where the healthcare disparities were specifically related to different factors, they were able to account for very granular levels of zip codes and find that even with the similar levels of air pollution, the zip code itself persisted as increasing the risk for preterm birth in that case. So we rely a lot on the methods and the volume of patients to show us where the signals really are true.
Ms. Flowers and Ms. Harad, thank you for your advocacy work and for sharing your experiences and stories with us today. In my role as co-chair of the Congressional Maternity Care Caucus, I've had the privilege to work with a significant number of national and local maternal and infant health advocacy groups. And their focus is generally on the broader issues facing all or specific populations of mothers and babies. And at the same time, I've worked with national and local environmental justice groups to highlight and mitigate a wide range of environmental exposures and impacts. Now, these groups usually focus on the global or specific community impacts of environmental justice. And both groups have a specific expertise, but do not traditionally work together. I believe that our success is going to depend on the ability of these groups to form coalitions and work together in advocating for environmental justice for all mothers and babies and communities. Do you have any suggestions that you could share with us on how we can encourage collaboration between maternal health and environmental justice groups so that we can be more effective in creating positive and meaningful change at the local, state, and the federal level?
I'll go first. One, I want to thank you guys again, because this is the start, right? Having these conversations publicly to be an example for communities and organizations is key. We have to have real conversation about what the real problems are. I want to acknowledge today, literally today, is the first time ever in the history of our lifetime that the UN is acknowledging a day of clean air. So today is the official International Day of Clean Air. And that just speaks volumes about collaboration. Once we acknowledge that there's a problem, it's easier for folks to get involved. And so coming together, working out how we can collaborate is just essential.
I'd like to say something about that also.
I can't agree more. We have to have a conversation, make sure that people are aware of these things.
Yeah, the reason I'm asking that question, and I know that somebody else wants on, but is that very often, at least my experience over the years has been, is sometimes these groups, rather than collaborating and working together, feel that they're in competition and don't work together as allies towards what really are common goals. And so my question was intended to find out, how can we change that perception that there has to be competition between these groups rather than meaningful cooperation where they work together as allies towards what really are these common goals?
Dr. Beckard wanted to say something, but before I pass the baton to him, I just want to acknowledge that competition is a good thing. Like, it's not always a negative thing. I think what has happened is that we've fostered this culture around nonprofits and advocacy organizations that they have to fight for the piece of pie. I think federally and from a municipality perspective, we need fair distribution of equity so that folks don't feel like they are fighting for a small piece of pie. We all make the pie bigger. And so it's very important that people of authority and decision makers create that culture that the competition for resources should not matter. It's about getting it done and unifying us so that we can accomplish the goal. Dr. Beckard, your turn.
Thank you. I would echo everything you said, but I would also add that I think the representative's question is an important one, because organizations that work together around common goals have a greater voice and bring a wider variety of potential solutions. So there's value to promoting partnership as opposed to staying in our separate silos. I just wanted to say that I'm involved with a nonprofit in San Diego, and we make a particular effort at outreach around certain campaigns like Community Choice Energy or getting the Green New Deal launched locally in San Diego. But we actually have a hub where a lot of these nonprofits, the one that I'm on the board of and several others, are located literally in the same building in San Diego, and they talk to each other, and they have they even socialize together, and they're getting to know one another. So although we have a tendency, I think, as people to be a wee bit competitive about our turf, I think it adds to our power to work together, and it's an important goal to pursue.
Okay, thank you.
Underwood, you have questions?
Hi. Oh, hi. Thank you all so much again for joining us today. I am so delighted about the experiences and the research and the data that you are willing to share. I'd like to start with a question for Drs. Picard and D Nicola. Your article made a clear and compelling case for immediate action to address the impacts of climate change on Black maternal health outcomes. I mean, honestly, we were just struck when we saw the publication, and I want to thank you for doing this really important work. As we explore the policy solutions, where do you think that future research is needed on this issue, and where should people be directed?
So I think one area for future research is to take kind of a cue from the last study I mentioned, where there's these natural experiments, like in California, where you remove the adverse toxic exposure and see if the outcomes change. So in that case, it's retiring coal power plants. There are numerous other ways you could look at either eliminating or minimizing the exposure. The analogy that I often make, and I don't think it's too much of a stretch in the analogy, is air pollution and secondhand smoke. You know, it was kind of this inhaled toxic that even if you weren't the one smoking the cigarette, you couldn't control the air around you.
Right.
When the evidence was clear, there was a public demand for that toxic exposure to be removed. So in cases where you could retire coal power plants or build communities, you know, a safe distance from fracking sites or choosing alternatives to fracking sites, I think there's definitely a role to involve the medical community when you're looking at city planning and the capacity of different housing units to provide just adequate living spaces during this increased volatile weather that we know we're going to have, whether it's the extreme hurricane seasons in certain coastal towns or the extreme heat waves like California is experiencing right now with all the wildfires. So I think, you know, as was mentioned kind of before, these increased collaborations where doctors step out of their silos and participate with groups just like this, we'll find these natural experiments and policy levers to reduce the exposures and hopefully watch the outcomes decrease.
And I'll throw a little bit more into that answer. One of the things that I learned in doing this research with Dr. D Nicola and our other experts was how complicated air pollution is. It varies a whole lot, even within one region, depending upon the time of year, depending upon the other sources of air pollution that might or might not be present. So we need a lot more work to identify where are the most vulnerable areas, what time of year do they occur, who are the people most likely to be affected. There's a tremendous amount that still has to be figured out along with this question. I think it would also be really worthwhile to be looking at different interventions from an efficiency standpoint so that the resources that are invested are used wisely. And we see if we're getting a good bang for our buck in terms of the things that we're doing and actually reducing harm to pregnancy and to the other vulnerable populations. That's a really important point. Thank you for bringing it up.
Well, I wanted to just follow up on something that you mentioned in that last response, Dr. Picard. We know that urbanized areas experience higher temperatures than outlying areas known as heat islands. And we know that there can be considerable temperature variation even within a city. Recent research has shown that summer temperatures can vary up to 20 degrees in different parts of the same city, and low-income neighborhoods and neighborhoods where people of color live tend to be the ones that are most exposed to extreme heat. So as we design these policies, how do we make sure that they're granular enough to address environmental risk at a neighborhood level? Dr. D Nicola, I think, is the one that mentioned the redlining, right? So we know that there is a significant neighborhood impact on this issue.
Well, there absolutely is, and I know I want to hear from Dr. D Nicola on this also, but it does vary street by street or zip code by zip code, and it varies widely during the course of the year, but a lot of these impacts are chronic impacts too. They don't just happen 1 or 2 days a year, they may happen for weeks at a time. And then in California, for instance, when you start throwing in wildfires, which there's no longer any end to the wildfire season, this sets off a particularly noxious variant of fine particulate matter that travels literally hundreds of miles away from where the fires are. So it's really important that we look at all of this in terms of where the local impacts are the worst. And I think we ought to focus our attention also on doing a better job monitoring areas that we know that are high risk, where there's not only elevations in temperature, as you say, due to redlining, but also increases in air pollution. These two it's like a toxic combination plate. They're happening together and simultaneously, and the same people are suffering those impacts. Anyway, Dr. D Nicola, I'm sure, has something to say too.
Well, at the system solution, I think we've mentioned a little bit about it. I think bringing these collaborations that are not maybe always as obvious together will help to maybe highlight the health benefit of a certain decision that a city planner has to make beyond an energy sector question or a commerce question. There's a health factor to consider here. At the individual level, I think we need to take a cue from the broader lessons about healthcare disparities and racial disparities, when it comes to maternal mortality, the message that shines through over and over again is that as hard as it is to understand or believe, Black moms aren't heard the same way. When they make a chief complaint or a symptom of, say, abdominal pain or heavy bleeding, it's not treated the same. And as a educator and someone who's a practitioner, we can start to do individual training that will address that, to make sure that all the people that we supervise and who we take care of ourselves, that we are aware of that tendency and we correct for it. And I think when it applies to symptoms that are related to environmental exposures, you could use the same lesson. So when women come in for, say, preterm contractions, which are a very common symptom on labor and delivery triage, if it's during a heat wave, maybe that should be considered differently. Or if it's, you can't assume that everyone's going home to the same type of home environment. So maybe the symptoms should be treated differently when you factor in the environmental exposures. And that's something that is at the medical system level where we train and implement hospital policies. But I do think you need both. I think you need the individual doctor-patient dynamic to change, as well as the healthcare sector and the energy sectors and commerce sectors to interact more.
Well, thank you all again for joining us for this important conversation. Thank you to Catherine and Alexia for sharing your stories. I know that so often as Black women, we know so many people socially who experience these difficult pregnancy or deliveries or negative birth outcomes, and it's treated as an individual thing. And we know here in the House Democratic Caucus, at least, that there is a systemic problem. And I thank you for bringing your personal stories and reflections to this conversation today. I yield back.
On behalf of Chairman Jeffries, who had to leave, I just want to thank all of you again. I thank my colleagues for joining the call. Now we have more resources in yourselves that we know.
Yeah.
Alexia, congratulations on your third child. My God, you're a shero being with us only after 11 days. So thank you so much. And Catherine, thank you for all of your efforts. It is just so very important. We know we still have so much more work to do, and don't hesitate to get in contact with any one of us. We will certainly be there for you and look forward to working with you in the future. So thank you so much again.
Thank you guys for being our champion. We can't do this without you.
Thank you.